Hey there! So I heard that you're going to be having surgery here at MCG Health Children's Medical Center. Cool. Believe it or not, surgery is actually pretty exciting. There are a lot of really neat things you'll get to see and do that you can tell your friends about later. If you are a bit nervous or scared, that's okay. I'll tell you a secret. Even grown-ups are a little bit nervous before surgery. That's why we made this video just for you. It will show you what you'll be doing, where you'll be going, and who you'll be meeting, as well as explaining some things you should know before your surgery. Are you ready to take a tour? Let's start at your doctor's visit, where you see one of your doctors in the clinic. After you and your grown-ups sign in at the desk, you'll sit in the waiting room, and you might have a chance to watch TV or do some arts and crafts. You will then go to the second floor of the Children's Hospital to a place called Pre-Op. There you will let the person at the desk know your name. Then a nurse will call you back to a room where you will stand on a scale and get weighed, and you'll get your temperature checked. Can you hear the machine beep when it's done? After that, the nurse will put a sticky piece of cloth or clip around your finger that will light up red. This will tell how many times your heart beats in a minute. Finally, the nurse will also put a cuff around your arm to check your blood pressure. When it's done giving your arm a giant hug, try to listen for the beat. The nurse will then ask the grown-ups some questions before talking to you and your family about a few things you'll need to know before your big day. You won't be allowed to have many of your favorite foods and drinks before surgery. Starting the night before surgery, you can't have any food or milk after midnight. Then on the day of your surgery, you will only be allowed to have clear liquids like water or Sprite up to 2 hours before coming to the hospital. After surgery, when you return home, you can have your favorite foods again. Other information, like when you should take your bath or shower and what medicines you should take on the day of your surgery, will be told to you and your grown-ups. On the day of surgery, you will park in the MCG Health Children's Medical Center parking deck and enter through the special lobby for kids. When you walk in, check out our dinosaur pictures on the wall. Next, you'll ride up the elevator to the third floor. Go ahead, press the button for the third floor. The third floor is our surgery floor. Walk down the long hallway to the check-in desk. Say hi and tell them your name so that they can let the doctors and nurses know that you are here. Now, just hang out and relax in the waiting area until the doctor and nurses are ready for you. While you are waiting, you may meet somebody called a child life specialist who will explain everything that will be happening and will answer any questions that you and your family might have. They might even show you some cool hospital equipment your doctor will use. Are you ready for the best part? When your name is called, you get to pick out a toy from the Dino store to take home. See, I told you surgery is exciting. We have lots of cool toys and other things to choose from for all different ages of kids, so take your time and find something awesome. You then will get to go to your very own room with a bed that has wheels, a chair, a sink, and a TV to watch. You will notice that all the nurses and doctors who work in this area wear blue outfits. At the hospital, these are called scrubs. The nurses and doctors wear these outfits so that they can keep the hospital really clean. A nurse will come in and ask your name and your birthday and give you a bracelet that has your name on it. You will wear this bracelet for the rest of your visit. That way, everyone will know your name. The nurse will also show you a picture of smiley and frowny faces and ask you if anything hurts. Let the nurse know if you are having any pain so the doctors will know. Remember the things that the nurse checked before you visited? The beeping machines and the thing that hugged your arm? You'll do that again, but this time you'll be a pro since you've done it before. After your nurse is finished checking you, he or she will leave while you put on a hospital gown, which is like a long t-shirt that ties up in the back. When you are ready, the nurse will come back in and give you a little cup of silly medicine to drink. We call it silly medicine because it sometimes makes you feel silly and goofy. After you drink your silly medicine, you will meet your anesthesiologist, which is another way to say sleepy doctor. After your sleepy doctor is finished asking your grown-ups a few questions, you will get to pick your flavor of sleepy air. But I will tell you more about that in a minute. You will now be ready to go to the operating room. Ready to go for a ride on the bed with wheels? This ride takes you to the operating room. Here you'll see all the doctors, nurses, and their helpers. Now they'll also have masks and silly hats on. Remember the sleepy doctor? He or she will be back to give you some sleepy air so you can take your special nap for surgery. The sleepy doctor will put a mask on your face that might feel squishy around your nose and mouth. And guess what else? You get to choose the flavor your sleepy air will smell like. Our flavors are strawberry, cherry, watermelon, grape, orange, bubblegum, cotton candy, lemon, cinnamon, banana, and root beer. What's really cool is that you'll be taking your special nap before you can count to 5. It works that fast. Now guess what? That's it. When you wake up from your special nap, your surgery will be over. You'll wake up in another room, and guess who'll be right there? That's right, your family. When you wake up, you'll probably see something in your hand called an IV. Your doctor put this in after you went to sleep so you wouldn't feel it. By the way, IV means in the vein, and it's how the doctors and nurses give your body a drink and medicine while you were taking your special nap and waking up. You might also notice 3 stickers on your chest. These stickers plug into a computer that shows us how your heart is beating. You may be a little cold. If you are, just ask the nurse for a blanket. You also may have some air coming from a tube that is blowing into your face to help you wake up from your special nap. You will start to wake more and more, and after a little bit, you'll be sitting up and drinking water. Well, that explains surgery and what will happen when you come to MCG Health Children's Medical Center. I hope that this video answers the questions that you may have. If not, please ask our nurses and doctors. They will be happy to answer any further questions or concerns. Thanks for hanging out with me and learning about what to expect on the day of your surgery.